All right, well, welcome everybody. Thank you for joining us again for our forum today. In case any of you don't know me, I'm David Forges, Vice President for Human Resources, Diversity, and Inclusion on campus. And we really appreciate you taking out the time to join us today for the updates that we have. Melissa, if you want to skip to the next slide, we'll just go over the agenda real quick. This presentation is being recorded and will be available on the HRDI COVID website. Today, as we have in the past meetings, we'll share updates on reentry and answer your questions as best we can throughout and at the end. You're welcome to put your questions in the Q&A, and we do have some panelists with us today who will answer some of those by typing, and then we'll cover some that are more appropriate to be covered in person. We are going to dive into our updates on our health and safety guidelines and our process for reentering campus. Please always check your email and the Campus Titans Return website for updated information. Y'all have been following along, you know that these things do change quickly. And Tara will put in the chat for you the update directly to those websites. All right, so let's dive in. As you all are aware, I'm sure by now, the Chancellor's Office gave us a preview that they would implement a mandatory vaccine policy. They've now updated that to say that we are now going to move forward with that mandatory vaccine policy. That was announced July 27th. We went ahead and announced that to the campus as well. All employees who have not already uploaded their first COVID vaccine dose record are expected to receive that dose and to upload that vaccine record by August 17th. As you recall, Cal State Fullerton was out there early with a plan to maintain the health and safety of our campus that included weekly testing and the opportunity to opt out by providing us with your vaccine record. With the Chancellor's new policy, we're just going to take that up, going to go ahead and move to the Chancellor's policy now. That doesn't mean that we've given up on the testing plan. Anyone who's not fully vaccinated will continue to need to be tested. Weekly testing at our surveillance testing site behind the bookstore. So until you're fully vaccinated, which means 2 weeks past the second dose for a 2-dose sequence, or 2 weeks past the 1 dose of Johnson & Johnson, that you are required to test weekly. And you should have been receiving those notices. If you have not yet uploaded your vaccine record, you should be receiving notices from us regularly of the need for you to do testing each and every week. And we do expect you to take advantage to complete that testing, and we will be following up with those folks who haven't done so. By requiring your initial vaccine upload by August 17th, basically means that if you're going to choose the 4-week interval on the Moderna vaccine, that you get your second dose mid-September and be in full compliance by the deadline given by the Chancellor of September 30th. We are really happy on campus. We have already collected the vaccine record from more than 70% of our employees, from more than 40% of our students, and those numbers continue to grow every day. We continue to get more of those vaccine records in as well. So we know that the number one thing we can do to keep our campus healthy and safe is to get folks vaccinated. The number 2 thing that we can do to keep our campus healthy and safe is to have those that are sick to stay home. Please, 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 if you are sick, stay home. Go and get tested for COVID. You can do that symptomatic testing still at the health center. But if you're sick, please stay home so that you don't expose the rest of our community to whatever that is, whether it's COVID or something else. We are extremely fortunate at Cal State Fullerton to have excellent sick time available to us. If it is COVID, if you do have a COVID-related illness, we also have ECRL available to us. So again, number 1 thing we can do, get vaccinated. Number 2 thing we can do is to stay home when we're sick. So please help us by doing so. It's just really important for the health and safety of our community. Melissa, you want to skip down to the next slide? Just make sure I didn't miss anything. Okay. Now that we're shifting to the Chancellor's policy, there is we have opened up the opportunity for exemption requests, and the Chancellor's policy makes provisions for exemption requests in 2 categories. First of all, for a medical exemption, we do need you to provide a doctor's note, and that will be verified by our accommodation team here in HRDI. And if you have a religious exemption that you're seeking, there are a series of questions that the Chancellor's office has put out that folks need to complete to be able to apply for the religious exemption. If you'd like to apply for either of those exemptions, you see the web address there where you can find the exemption form, request the exemption form, send us an email, we'll send you the form back, complete the form, send it back to us. Medical exemption, we do need you to go and get a doctor's note. Religious exemption, we just need you to complete the form, and then that'll be reviewed again by our staff here in HRDI. Anyone who is approved for an exemption will need to continue to have surveillance testing every week. So you will still need to go over and get your testing every single week at the testing area behind the bookstore. And that's how we'll continue to handle that. Again, anybody who does receive an exemption will need to continue to be tested each week. I think we can move on to the next one, Melissa. In order to support our new vaccine policy from the Chancellor's office, we will have a vaccine clinic available next week in the foyer of Titan Gym all week. You can come. This is in partnership with the county. We'll have all 3 vaccines available, Johnson & Johnson, Pfizer, and Moderna, all 3 available. We are asking folks to make an appointment. However, we will take walk-ins, and you are more than welcome to bring family members, friends, colleagues, anybody you'd like to. That vaccine clinic will be available. We also know that for our students, many of them may have put off getting vaccinated. We're providing this opportunity for them. And for anybody else who just hasn't had a chance yet, it is available there. You're welcome to go during your work time to go over and get your vaccine. If you choose Pfizer or Moderna, they will schedule that second dose with you as well. If you choose the Johnson & Johnson, then you'll just have the one and done. You'll be ready to go. And then you go ahead and upload your vaccine record and be set and not need to engage in the regular testing. All right, Melissa, let's, should we pause are there any questions? Kristen, Mary, any questions that would be helpful to deal with now? Should we keep going?
There are a lot of questions being answered live, so I think you can keep going and we'll take a break at another slide. Okay,
thank you. Y'all have seen this little diagram before. We put this together to describe what needed to happen. Basically, if you have been vaccinated and you've uploaded your vaccine record, nothing else is required of you. You're in good shape, good to go, thank you. Those vaccine records are being verified and taken care of that way. If you have not yet been vaccinated, you'll see there in the little no circle, weekly testing is required of you. You do need to have weekly testing, surveillance testing over at that tent behind the bookstore. If you're in the vaccine sequence, you need to have weekly testing as well until you're fully vaccinated 2 weeks post your final vaccine. And that testing is surveillance testing, and we really need your help. Go over there for your regular surveillance testing. If you have symptoms of any kind, symptomatic testing is available at the health center. You can go to the health center, get that. You can also get it from your healthcare provider, from any of the counties. There's lots of opportunities out there for symptomatic testing. Please do not send symptomatic people to the bookstore area. Please send those folks to the symptomatic testing. Testing at the bookstore area happens every day, all day. Fridays only until 1. It is behind the Titan shops. It's pretty quick. And I think once people have been through it once, they figure out pretty easily how to get through each week. And we've been getting better and better at that. It's actually been fun. Several of the other campuses have been out to take a look at the setup that we have. And it's been really encouraging to know that that we've put out kind of the gold standard of response protocols. And many of the other campuses now are following along.
Can I ask a few questions in the chat related to testing, since that was the slide before? Drive-through option, access for people with disability, and what kinds of IDs or things do people need to come if they're doing it walk-in?
Thank you. I'll go ahead and answer those quickly. Unfortunately, we will not have a drive-up option at this vaccine clinic. It will be for those So we do encourage anyone with a disability to please bring a wheelchair or other method for being able to get into the Titan gym. There is a ramp for accessibility reasons. IDs are generally state or other government issued IDs and school IDs. So if you have someone that is under the age of 16 that does not have, anyone 16 and older, but they may not have a state issued ID, a school ID, it needs to be something that has preferably a name and a birth date if possible, but if not a birth date, then a name. And then you may want to consider, if they're under the age of 18, bringing a birth certificate just to confirm age.
Thanks, Mary. And same thing, our testing location, surveillance testing is accessible. We did ensure accessibility there. There's not a drive-through option for that testing, but the tent is accessible. So should be able to take care of that. Other questions, Kristen?
I think you can move on.
Okay, thank you. Folks also saw last week, we did update, was it last week? Was it this week? Every day seems like a year. Was this week, actually. This week we did update Directive 22. I think it was actually just Tuesday. To be in line with CDC and CDPH guidelines, where we're now requiring all members of our community to wear a mask while indoors. There are a few minor exceptions to that. I'm in my office right now with my door closed, so I'm able to take my mask off. I'm the only one in my office. I think several of my colleagues are in the same place. If you saw Melissa from our team on a few minutes ago, she's in a more public place. She has her mask on, but masks are required in all of our buildings for every member of our community at the moment. We put that out there through at least until September 30th, hoping that the Delta variant will die down some by then and we'll be able to adjust that. But for now, we are requiring masks in all of our facilities. The link is there, so you can review the exact details there. But for the most part, the default is that masks are now required on campus. Melissa, you want to skip down to the next one? So the information contained in Directive 22 includes the mask mandate, also includes the testing requirement. And those two pieces are presidential directives, and we are required to comply with presidential directives. And we do have accountability measures in place for folks that don't comply with those directives. Like the vast majority of the things on campus, we are responsible for holding each other accountable. So if you see other folks on campus who are not wearing their mask indoors, please remind them to do so. And in the vast majority of cases, that's going to take care of it. And we'll hold each other accountable. If there are folks who really become a problem, or you really are struggling with getting them to comply in that way, you're welcome to alert one of us, and we'll be happy to help you deal with that. We do plan to employ our progressive discipline provisions in our collective bargaining agreements to enforce Presidential Directive 22. We also plan to do so similarly with our vaccine requirement as soon as the Chancellor's office finishes their statewide meet and confer with our union partners. But we do plan to pursue progressive discipline on those things. So we do expect every member of our community to comply with the tenets of Directive 22, and we will be following up with folks where that compliance is an issue. Skip down to the next one, Melissa. We are still asking, I said this at the beginning, but the number two thing that you can do to help us maintain a healthy and safe campus is to stay home when you're sick. We are still asking you to please take that personal assessment when you're at home. That doesn't mean that every little, everything needs to become a big issue. If you normally have allergies and you take an allergy pill, take that allergy pill. If you feel okay, come to work. If you feel sick in any other way, if you feel sick, out of the normal, we want you to stay home. We want you to stay home and get better, whether that's COVID or whether that's a cold or flu or whatever it is. Stay home, use your sick time. Once you're better, you can come back to campus. And that's the thing that we're going to do to make sure that we maintain our safety. If you do feel like you're experiencing COVID symptoms, please get tested. Again, that symptomatic testing is available at the health center, as well as lots and lots of places out there in the community from your normal healthcare provider or any of those other places that COVID testing is available. We skip down to the next one, Melissa. Okay, testing positive or exposed to COVID-19. Here's the thing. We have already collected the vaccine record for more than 70% of our employees. If you are vaccinated and you do not have symptoms, even if you're exposed to someone with COVID-19, you do not need to do anything different. You can continue coming to work. You can continue coming to class, continue your normal life. If you're vaccinated and you don't have symptoms, you're good to go. If you develop symptoms, stay home. Get better, get tested if you need to, whatever that looks like for you. Stay home, get better, get tested. If you're vaccinated and you don't have symptoms, you're good to go. Okay. Now, that small number of folks that we still have on campus that have not yet been fully vaccinated and given us their vaccine record for verification, we are actively doing contact tracing when there are exposures. Again, I'm going to say it one more time. If you're sick, stay home. Stay home. That keeps us from having to do contact tracing. That keeps you from exposing your colleagues and your friends on campus to whatever that is that you might be sick with. We are actively doing that contact tracing. We are reaching out to folks and working with them. Anyone who's symptomatic should stay home and use their sick time or their ECRL leave as appropriate. If you're sick, stay home. If you're unvaccinated and you've been exposed, we will be contacting you through the contact tracing process and working through with you what that means for you. We are still under Cal OSHA guidelines where we do have to exclude folks who are unvaccinated and have been exposed, and we'll work through with you individually on what that means for you and when you can come back to work. So if you get one of those calls, know that that's what that's about. Again, for the vast majority of us, we've already been vaccinated and given our vaccine record. As long as we don't have symptoms, there's nothing else that we need to do. We can keep coming to work. If anyone is exposed or has symptoms or is tested positive for COVID-19, we are asking that you report those to us so that we can do the appropriate contact tracing and follow up with other members of our community. Should we pause for questions, Kristen? Anything on that?
There are a number of questions about exemptions. I was going to post, or Tara, can you post in the chat the exemption link, the site about exemptions for the campus to apply?
Great, thank you. Again, those exemptions are available for the vaccine policy. We are not at this time granting exemptions for the testing policy. You're welcome to reach out and talk to us individually if you have concerns about that. Thanks, Tara.
Another question about how folks can get access to today's presentation later, to save it, to look at it and review it.
Yep. Usually takes us about 24 hours or so, and then we're able to get it up on the HRDI COVID response website. We could probably drop that link in there it is. Thank you, Tara. Before I can even say it, she's got it in there. It's in the chat now for folks to be able to check that out. All right, let's skip down to the next slide, Melissa. Reentry steps. Here's the things that we'd like you to do, continue to do. Visit the Titans Return website, review Presidential Directive 22, review instructions for a safe return. Please upload your vaccine form or apply for an exemption. Make your weekly surveillance testing appointments if you have not uploaded your vaccine record or if you're in process of being vaccinated. There is a training that we need everybody to take. And again, please do not come to work if you are sick. If you heard nothing else from me today, I hope that you heard that loud and clear. Do not come to work if you are sick. Come and complete that daily self-check. When you wake up in the morning, take stock, make sure that you're not sick and that you're in good shape to come to work that day. Again, continue to check your emails from us. These things do continue to change, and we will continue to update you throughout as we get new guidance. Did I see, was there something, Mary, that you wanted to share, or was there a question in there? I thought I saw something slip past as we were talking.
If I can just interject a little bit, there's lots of questions in the chat around what's going to happen if there's an exposure. And I know that You may have covered that already, but I think we just need to go over that really quickly again.
Please.
So anytime that there's a reported positive case on campus, that information comes to the Cal State Fullerton COVID-19 response team. Myself and our team, and we have about 20 people on campus that are trained to respond to those cases, will contact the individual, find out who their close contacts were and in what locations they have been on campus. With that information and some other information that we get from the campus and other folks, we will make a decision on whether or not people need to self-isolate or self-quarantine and remain off campus. We also make a determination on whether or not spaces need to be appropriately cleaned and disinfected based on the length of time that that person had been on campus and how long ago they had been on campus. That's all based on CDC guidance and our local public health orders. Per our Cal OSHA requirements and AB 685, all employees who have been in a facility where there's been a positive COVID-19 case will get notified from Human Resources. So that means faculty that have been in a classroom where students have been and had positive cases will be notified of a positive case. Faculty and staff will not be notified who that positive case was. We also will not be notifying faculty if a student reports to us that they tested positive, but were not in the classroom. That does not get notified to faculty. It's up to the student to communicate to the faculty that they will not be in class. So I just want to confirm our protocol is once we receive information that there's a positive case, and we want folks to report that through the online reporting form on the COVID-19 website, our team will respond, will obtain all the information that we need to determine who needs to stay off campus and for how long, what cleaning needs to go, what needs to happen through environmental health and safety, and then when you can expect to be back on campus. So I just wanted to jump in and explain that really quickly, David,
Thank you.
that people could understand that they will be notified.
Thanks, Mary. Thank you. Thank you. Okay. Melissa, if you want to jump down to the next slide. Here's some QR codes that'll take you to some of those places. I think we probably put most of these in the chat as well, links to these, but here's a place where you can grab those quickly, especially if you've got your phone handy and you're a good QR code reader user. These will take you right to those things. And let's pause here for any other questions that might be helpful for us to take live.
So there are a number of questions related to faculty and departments knowing if a student has been vaccinated or has an approved exemption before entering campus and the classrooms. Is there any notification to faculty and departments about this?
Thank you for that. The answer is no. So there will be, that is individual health information, and faculty and staff will not be notified of other faculty, staff, or students' vaccination statuses.
Thanks, Mary. Let's see, take a quick, see if we can look through the let's see, the question there, if someone does not get vaccinated by September 30th, we will be working closely with individuals on that. And we will be employing the progressive discipline process that is available to us to enforce Chancellor's Office executive orders and presidential directives. Any other things people want to jump in and answer questions on live? Let's see, looks like there's another question there about supplemental paid sick leave is still available for faculty. So yes, that is still accurate.
David, would you be willing to revisit the criteria that is followed by others to give guidance as to when someone needs to quarantine or self-isolate if exposed?
Sure. I think the top line I was giving on that, right, is that if you've been vaccinated and you do not have symptoms, even if you're exposed, you don't need to take any other action. And the vast majority of our folks have been vaccinated and given us their vaccine record. If you've been vaccinated and you don't have symptoms, even if you're exposed, you don't need to do anything further. Mary, you want to add to that?
I can just quickly go over, there are specific definitions of what an exposure is and what a close contact is. And we use the definitions that are in both the CDC guidance and the Orange County Public Health Order. So just because you may have been around someone who is positive for COVID, it depends how long and in what circumstances to determine whether or not you need to self-quarantine. Vaccination status is also a factor. There are other factors, including other family members in the home. So there's all kinds of factors that go into making a decision on whether someone self-quarantines. For self-isolation, if you have symptoms of COVID-19 or have been tested positive or were told by a medical provider that you're likely to have COVID-19, then you will be required to self-isolate and remain off campus. There are some options for testing in order to come back earlier from a self-isolation. But again, all of that is explained by our COVID-19 response team when we are made aware of an exposure or a positive case. We really do want to talk to you to make sure you understand all of those options. So please notify our team through that online reporting form, and we'll get back to you within that business day.
Great.
And David, I know you mentioned this, but when people become ill with COVID or have been exposed and are symptomatic, maybe not tested positive yet, faculty members are asked, in the case where Mary's team has done all their investigation and someone is told that they should not be on campus, a couple of people are asking the question again if they can teach remotely. I heard you say if you're sick, you must take leave, and I just want you to go over that again.
If you're sick, we'd like you to take leave and get better. If you've recovered and you're able to teach your classes remotely, there are provisions already made for up to 20% of a class to be delivered an alternative method, and we would encourage folks to make use of that.
I would add for faculty who are asking these kinds of questions that we're producing FAQs and guidance now that we hope will help. We're working with the deans, and we're looking to figure out the answers to those questions. We have modalities for our courses. We do not want faculty changing the modality of their course. So putting a course online that is in person is not an option. When you are sick and there is a course or two that may need to meet virtually, just as David said, it is possible for faculty to do those things. We would prefer, though, not to adjudicate that in great detail here now. We would prefer that you remember that the deans are right now working on acquiring the best information, that they'll be working with chairs, and that we're all doing the best we can to manage and provide the guidance that's needed as we proceed with this semester.
Thank you. Okay. Melissa, I think we might skip down to the next slide. We haven't yet set the date for the next forum, but we will be doing so soon. I think, Carolyn, you have been talking about also potentially hosting a separate one for faculty. We will be putting those dates out as soon as those are set. Right now at this point, we're waiting for additional things to happen, for additional guidance to come, for us to actually have something substantive to share. We had plenty of that today because there's been a lot of moving parts, and I'm sure that there will be probably in the next few weeks. And we will continue to host these forums as there's information to share with folks. In the meantime, you are always welcome to reach out to us here in HRDI. Please reach out to your supervisor where you have questions or need help with things. Any of the leadership in your division or your department, always here to help to be able to wade through. We know that there's lots of moving pieces. We know that this continues to be a somewhat uncertain time. What we are confident of is the gold standard program that we have put in place at Cal State Fullerton to ensure the health and safety of our campus community. We have been working on this actively throughout the pandemic, and we believe that we put the best plan into place months ago. And we're really thrilled at this point to be where we're at in terms of collecting vaccine records and knowing that the majority of our campus community is vaccinated, and that we are also engaged in a testing plan that is designed to maintain the health and safety of our community. So know that we are taking it seriously. that we have an excellent plan in place, and that we will continue to adjust and respond to the factors on the ground as we continue to respond to the pandemic. I'm thrilled today to be able to come to you from my office. It's been great to be out and around campus. I was in PLN 130 today for a meeting. It was great to see many folks, to just be out and about around campus, kind of getting back to what we do. I don't miss my dining room at all. I'm really thrilled to be back on campus and to be able to see so many of my colleagues, and to know that that next week our faculty and our students will begin to join us again, and that we'll look forward to a really great semester of doing what we do best, providing that education that's such a game changer for our students.
Thanks, David. And I also just want to thank people for being here. I want to stress that, you know, all of the CSU campuses are working together. My connection with the provost on other campuses, we are all pursuing a largely in-person fall, and we're all doing that with the confidence that we have great health and safety guidance and the commitment that the transformative education that our students need is an in-person experience largely. So I want to thank everyone for attending, and for also just the work that people who prepare for these sessions do to make sure we can bring you all the latest information. We are in very good hands on this campus.
Thanks, Carolyn. We'll stick around and keep working through some of the questions. But otherwise, we want to thank you for taking some time today to join us. Very happy to see so many of you back on campus, and wish you all a great new year, a very happy new academic year. Thanks so much, everybody.